Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Reem Naguib. I'm lecturer and preceptor at King Khalid University, Department of Clinical Pharmacy. What I'm going to review with you today, inshallah, is a topic about asthma. Okay, I think you have a good idea since therapeutics 4 maybe about asthma and COPD. So we're gonna review the major concepts today to refresh your background. Okay. So we're gonna start with an outline, or we're gonna start with a background knowledge, some background knowledge about respiratory system anatomy and pulmonary disease spectrum. Okay, and then we're gonna go through some information about obstructive versus restrictive pulmonary diseases, and then we're gonna go through some common investigations in obstructive pulmonary diseases, and then we're gonna go through asthma details. Okay, so maybe we can refresh before we start. So what do you think? Obstructive lung diseases are characterized by elevated FEV1 over FVC, reduced FEV1 over FVC, reduced FVC, or none of the above. Try to recall that knowledge. Okay. As we can see, or as we can remember, this is the basic anatomy of respiratory disorder or respiratory system. Okay, we are going here to talk about the lower respiratory anatomy, which starts with the trachea, and then it goes into the two bronchi. Each one goes into a lung, and then goes into many bronchioles, which terminate with the terminal bronchioles, and then the alveoli or the air sacs. Okay, and here to your left you can see the what we call muscles of expiration and muscles of inspiration. These are the muscles that help us to take a deep breath or exhale air. Okay, so as we talked earlier, this is the trachea, goes into the bronchi, the two bronchi, and then the bronchioles, as you can see, at each side of the lungs, and then it goes into the small bronchioles, which are the terminal bronchioles, and then the respiratory bronchioles, and then the alveoli, as we call it, the air sacs, where gas exchange occurs. This is the site at the alveoli. Okay, you can see these are the small air sacs surrounded by a capillary network in which gas exchange occurs. So carbon dioxide goes comes out of the circulation and is replaced by oxygen.